I am Varun Puri. I am a professor of surgery at the Washington University in St. Louis and a practicing thoracic surgeon and health services researcher. Ensuring that patients are involved in their management in the perioperative period is extremely important towards helping with a smooth postoperative recovery. The first step is actually involving patients as a team member in their operation or recovery period. This starts with involving them in all the decision-making processes, both for the patients as well as family members who provide support and are caregivers in the peri-treatment period, and then talking about certain specifics. These specifics may be general in nature or may be associated with specific medical comorbidities that patients may have. An important one is smoking. 85% of patients undergoing surgery for lung cancer are either current or former smokers. The vast majority of patients who are being evaluated for lung cancer resection have smoked within the preceding 6 months. This is greater in an older population and less so in a female population. However, smoking cessation is extremely important in the perioperative period. Your physicians can come up with a comprehensive plan as to how that might be approached. This includes several components, one of which is counseling, which can be offered through the cancer center, your primary care physician's office, or a smoking counselor who may be associated with your oncology team's offices. The next is using medicines or nicotine replacement therapy. There are two well-known effective medications that can be utilized by your physicians in lowering the likelihood of you wanting to smoke in the perioperative period. Additionally, nicotine replacement therapy, and nicotine we know is an addictive agent, so it's important to use nicotine replacement in the form of either nicotine gums, patches, or other forms of replacement to help with smoking cessation. Finally, the use of vaping has come up significantly in many preoperative discussions. Vaping provides nicotine and certain other chemicals aerosolized as an alternative to using standard cigarettes. There are no convincing studies in the perioperative or peri-treatment period which show that vaping can be used successfully to lower the likelihood of smoking or improve smoking cessation in the perioperative period. Additionally, we are not certain that vaping is without its own set of harms. We know that vaping decreases what is called microcirculation, which is blood flow in tiny blood vessels which are all across the body in all organs. So if one undergoes major surgery, there are incisions both outside as well as on the inside of the thorax or the chest where healing needs to occur. And if microcirculation, which is blood flow in these tiny blood vessels, is diminished, that lowers the likelihood of healing and may exacerbate wound-related complications. Another important component of preparing for surgery is physical activity. And most individuals are encouraged to increase their physical activity, even if they're active at, say, work or other activities they need to do as part of their physical function or chores they need to do. I encourage all my patients to go for a dedicated walk, both morning and evening, in the period of time that they have coming into surgery. And most patients see that their exercise capacity improves remarkably, even within a short period of time, which is the waiting period for surgery, which is generally 1 to 2 weeks for most lung cancer patients. Additionally, medical optimization is important for patients being considered for major surgery. In patients who have high blood pressure, it's important to ensure that their blood pressure is under good control. This is important, particularly not from an operative standpoint, but also management under anesthetic. Many patients who undergo lung cancer surgery have diabetes mellitus. And it's important to know that the patients have good short and long-term control of their diabetes coming into surgery. Poorly controlled diabetes is a risk factor for both wound-related complications as well as other complications in the perioperative period. So it's important to ensure that blood sugars in the preceding period of time before surgery are well controlled, as well as hemoglobin A1C, which many diabetics are familiar with and is a marker of how good the long-term control of diabetes is, should also be under good control. We know from many prior studies that nutrition is an important part of recovery. There are also recent studies which look at specific components of nutrition and certain agents which are referred to as immunonutrition, and emerging studies will help us identify if there are specific nutritional agents that are to be utilized in patients preparing for lung cancer surgery. It's important to have good, healthy nutrition coming into surgery. Weight loss prior to surgery is a risk factor for wound complications as well as other complications after major surgery. If patients are identified as having lost a significant amount of weight or being malnourished based upon their blood testing or other parameters, we refer our patients to a nutritionist who oftentimes will see the patient at the time of their initial evaluation by our surgical team or their oncology team in the same appointment. Additionally, it's important for patients who are on blood thinners to have their blood thinners evaluated for either stopping or conversion to other blood thinners which are safe in the perioperative period. It is increasingly common that patients use agents which are called antiplatelet agents, which are such as aspirin or Plavix, also called clopidogrel, which are commonly employed. Some agents are safe to use in the perioperative period, for example, aspirin, while other agents such as clopidogrel or Plavix need to be stopped for several days. So these are discussions to be had with the surgical team prior to surgery. There are also other important things that patients can do to decrease the likelihood of postoperative complications. As an example, pneumonia, which is commonly seen in smokers or patients with poor lung function coming into major surgery, particularly lung cancer surgery, can be lowered in its incidence with good preoperative hygiene of the oral cavity, importantly using either chlorhexidine or other mouthwash type agents for good oral hygiene. We have some preliminary evidence to show that this is effective, and a larger study is being currently planned to pursue this question more effectively. In addition, there's a certain specific device called an incentive spirometer. Many patients who have had loved ones in the hospital may have seen their loved ones in the hospital using a device where they do an exercise where they try and inflate the lungs by taking deep breaths through a small machine, and a disc in that machine tells the patient how deep they're breathing, and the higher they're able to raise the disc, the larger the volume of air that they're pulling into the lungs. This helps in keeping the lungs well inflated, helps patients in clearing secretions, and oftentimes is used by patients in the preoperative period as preparation for using in the postoperative period. Finally, an important part of managing patients in the perioperative period is ensuring pain is well controlled. Increasingly, a number of patients are already on painkillers coming into major surgery, and these painkillers are utilized for other forms of pain such as back pain, joint pain, or other chronic pain related problems. It's important to have a discussion about pain management with your surgical team, particularly if you are on these pain medications, because it can be somewhat more challenging to control your pain, and an appointment or an evaluation by the anesthesiology or pain management team in the preoperative period may be helpful. Finally, a number of these things we just talked about are often rolled together into bundles. One of these bundles is formally called prehabilitation, sort of rehabilitation, except in the preoperative period, hence prehabilitation. And in patients who are at a higher risk of perioperative problems, we often encourage patients to enroll in prehabilitation programs. Finally, many of the things we talk about are what we call modifiable factors. And it's important to pay attention to these factors in the preoperative period, both by the patient and their caregivers, as well as their surgical teams, to optimize their chances of doing well in the postoperative period, both short-term as well as long-term. Finally, many of these concepts that are utilized in the preoperative period in the form of prehabilitation or patient optimization dovetail into a new strategy that is utilized in the postoperative period, which is called ERAS, which is Enhanced Recovery After Surgery. The principles that guide this care in the postoperative period are very similar to those that are utilized in the preoperative period, the goal being to shorten hospitalization, improve functional capacity, and enhance recovery as quickly as possible after major lung cancer surgery.